The image here shows a slide tray, white in color, which has a pink border. And please don't be surprised, but this pink border is actually a technologist's idea who came up with a way to distinguish molecular slide review trays from the other slide trays on the pathologist box by applying nail polish on their side.
For molecular reviews, a pathologist has to look at a slide. Let's have an example. And they have to let us know which portions are tumor and which portions aren't, because we're not trained pathologists. And we just want to isolate DNA from the tumor region, because we'll give the patient a false negative if we isolate normal. So this takes you, what, Dr. Sharma? Like a minute to do?
Yeah.
So we color-coded our slide trays so they know that this is just a quick review.
If it's a busy surgical service and a surgical pathologist is going through 20 slide trays in a day, if you move in one of these slide trays just for review, it might have to wait till the end of the day or middle of the day before turns come. The disadvantage there is that it can actually delay a lot of turnaround time in the molecular lab, because everyone is waiting for the surgical pathologist to look at this slide. And for the defense of surgical pathologists, though, they may not even realize that such a slide tray is waiting for them. So we brainstormed about this idea. Actually, one of our very competent medical technologists said, how can we make them stand out? Well, what stands out more than brightly painted nail polish? So all she did was apply some nail polish on the side, and whenever on our routine practice we get these slide trays, they stand out because they are pink and shiny, and we know that we can stop what we are doing, quickly look at the case, mark the area with the tumor, and then inform the molecular lab. So that way molecular lab is no longer waiting for the pathologist to look at the slide. They can get on and load the assay as soon as possible. The pathologist gains because they are able to distinguish this without a lot of effort, and with one quick look in an office, a busy surgical pathologist's office, anyone can find out where these trays are. Earlier it used to take minutes to sometimes half an hour to figure out where a specific case was. So it's a great mistake proofing idea, involves the use of a very inexpensive method and something that can be done at each and every molecular lab which faces the same problem.